Hello and welcome to the provider familiarization video for the Uniform Services Asthma Action Plan. This is a smart Adobe PDF that is built in with automation and background JavaScript coding to make your management of asthma more guideline concordant, faster, safer, and easier. So let's start with filling in the boxes. You'll do all of the demographics and fill in the clinician's name, and you'll type in the patient's date of birth, and perhaps it's this. You can click over the letters today's date. It'll output that for you. And then maybe you'll put their email or something like that. It's certainly helpful to add their weight and then whatever your contact is. Then you can see there's several options here at the top that you can see on the screen, but won't be visible when you print. First is a good helpful tool of the respiratory treatments guide provided to us by our teammates at Allergy and Asthma Network. You can pull this up as you're filling out with the patient and make sure you're using the same medicine they've used before and other things that you can use to your advantage. It's also important, we're trying to make this asthma action plan work for you to be more guideline concordant with the 2020 update by the NHLBI to the asthma guidance and management for children. You can see it's age-based with these different definitions for intermittent persistent. You can click that off. Now, it can be difficult, of course, to ask all of these questions in a single 15-minute acute visit, but what you could do here is enter all the information that you can. Maybe your patient can't do PFTs. If they're a pediatric patient, we wouldn't recommend doing peak flows, but if they're an adult, you could, and you would output that. You can see by clicking through and hitting OK, this patient has been defined by the NHLBI definition as persistent and severe severity of asthma. You can see no medicines have been selected, but I have this guideline check feature built for you that says, warning, because of their persistence, it would recommend an inhaled corticosteroid. You can see there's pictures with matching symptom text, and this is a how-to video. It outputs first to albuterol, but let's say we know that this patient's going to need a controller medicine. And then let's add on an albuterol rescue inhaler. Now, what this does is it takes the age of this patient and it outputs for you a meter dose inhaler of the fluticasone with a spacer, given that this should be by spacer, not by mask for your patient's age. And then finally, you've also filled in a rescue short-acting bronchoagonist. Now we could come back and see that this guideline check is in place. And because you have filled in an inhaled corticosteroid for this persistent asthma, you are no longer in the warning phase. You can go through and again, fill more things in here based on your own clinical judgment. And notice that this information that's put in here at the bottom, it will change automatically with your patient so that you only have to put it in once. We have a patient familiarization video here at the bottom. And then if you're opening this for the first time, this video is contained with this QR code, but it will not print with the form itself. We hope that that's been helpful and that it will enhance your care of pediatric asthma. Have a great day.